Hi guys, my name is Joel Gonzales and I'm with Megagen America, and this is my trusted helper, Emily.
Hello.
Okay? What we'd like to show is a complete sterile surgical setup. So we're in an operatory right now, and what we're going to do is show you how to set up in a sterile fashion for a dental procedure, for a dental implant procedure in a dental office, utilizing the Add Surgical O-Pak. Now the O-Pak is phenomenal because it has everything in there for a sterile procedure, but not too much. So the cost is very, very good, but at the same time, it allows you to do a complete sterile surgical setup as well as technique, which is the ultimate safety for your patient, especially in these trying times that we've experienced during COVID. So what we're going to do is now show you step by step the ideal surgical and sterile setup utilizing a non-sterile individual, utilizing non-sterile gloves, and I'm going to be in sterile gloves. So what we want to do when we actually scrub in for the procedure is scrub in after you've donned your bouffant cap and mask, as well as any sort of eyewear that you may be wearing. Now I'm going to emphasize one thing. Notice on my eyewear, what I'm going to take off my glasses, and you can clearly see a piece of tape here. All right. What that piece of tape does is keep you from fogging up your glasses during the procedure, whatever the procedure may be, whether it's clinical or setup, etc. It basically keeps your glasses from fogging up, which is very, very user-friendly. The other thing we're going to have here is, after the surgical setup, is your gloves, and what gloves we're going to use relative to whatever size you need, whether it's 6.5 is small, 7.5 is medium, and 8.5 is large. So we have a 6.5 for a small person and a 7.5 for a medium person. Okay? So let's go ahead and emphasize the fact that I've already scrubbed in. My bouffant cap is on, my mask is on, and I'm ready to proceed with the procedure, as well as my assistant has done so as well. Remember though, she's non-sterile and I'm the sterile. I really want you to understand that difference between the two. So she will be opening up the packages, etc. for me, then I will be proceeding with the procedure. So if you would please go ahead and open up my sterile gloves as you would do it when I'm in a sterile setting, so where I can grab it in a very, very sterile fashion. So notice she opens up the top of the package, and she never comes in contact with the sterile item. She simply opens it up and then peels it back, where the person can then grab it from the inside here and simply pull up. Okay? I then set my gloves down, and what I like to do is, at the very back, I like to fold this over like this, because these coverings have memory. So this right here, and then bend it down like so. That way you're not dealing with the package trying to close upon itself. So then I'm going to always start with my right hand because I'm right-handed. So what I'd like to show you how to do that is you grab it at the very edge of the glove, and you simply put your thumb up and just follow exactly as the glove is laid out with the thumb up, and it slides right on. But notice I'm never coming in contact with my body yet until I put the glove on and just simply release. Now I do the exact same thing with the left hand. Get it ready to place, slide it up, grab it from the edge, slide it up, and it's now placed, and I release it against my body. Now it's considered non-sterile, but what I do is I grab it from a different area, and I pull it up and adjust from there, like so, and do the same thing here, like so. Make sure your gloves are seated all the way down. Now, as far as the extra coverings and trash, etc., what we're going to do for now is simply throw it on the ground. The reason is because we're not concerned with that now. We will clean up after the sterile setup is done. Okay? So now what my assistant has to do is now open everything up for me, and notice I'm not moving my hands. I'm going to put my hands here until I'm ready to do what I need to do for the setup. O-Pak, and I'll show you the contents of the O-Pak first. But we want to open this up very minimally because this actual pack it ends up being a little trash bin for us at the very end. Thus the adhesive, I'm not touching the bag, thus the adhesive right here on the front. Yep, and then simply, okay, pull it back just a little bit more, not from there, from the back end. Yep, there you go. Now notice what she's doing very, very slowly and succinctly is putting it to where the edge is open. Now I can grab it cleanly without contaminating anything and simply pull up. Remember, we will not throw this away because we will use it. Now here's where the O-Pak, again, is very user-friendly because it has a nice box where everything comes packaged in it. So now once I set this down on the counter, it is no longer sterile underneath where it's touching. But everything inside the contents is considered sterile. So I set this down, move this out of the way. And now I simply grab this part. Again, anything that's now touched the counter, I can no longer touch. And I am opening this up here, and notice I'm moving my body away so it doesn't come in contact with me. And now I'm orienting the package, covering as much surface area as I can. Now everything is displayed in a very, very, again, clean, sterile fashion. This, by the way, is an ideal scenario for your assistants because after the procedure is done, it's very, very easy to clean up afterwards. So now let's look at the contents of the O-Pak. So here are your sterile gowns for your assistant and the doctor. They are universal size, so size does not matter. And let's separate that one after the other. The reason you want to separate is because obviously it's going to be easier to don your gown, etc., if everything is separated for you. All right? So now we're simply putting everything out that we have here. There's a couple of masks. There is a really nice patient drape with the adhesive draping here. And then I'm going to put this over here in the corner for now. We have more bouffant caps. We have more sterile draping for your counter space. There's actually 2 of them in here. And let me find one because there's a little secret hidden bin in here. Let's see if this is it. In between the sterile drapes, aha, here it is. There is light handles, adhesive light handles here, okay? These are very, very user-friendly. So I like to have this one open so that way I can see the adhesives and I'm able to set everything up where it's supposed to be. Let me continue with the product here. Then there comes with surgical suction tip gauze, cotton tip applicator, the whole 9 yards in here. So now I'm ready to actually just open this up. I'll put this inside my bin here, which is a very nice tool for your to keep things in, saline, etc. in here, extra anesthetic, soaking in the saline. The trash, again, throw it on the floor for now. There is a sterile towel as well. And that's pretty much it. And you can see the contents of the O-Pak and its box here. All right. Again, this is nice, very, very nice to put your extra saline, etc., in here, anesthetic, whatever you're going to use. Now, what we need in order to complete the setup for the assistant and doctor are the sterile gloves, as well as obviously the instruments, motor, etc. But let's just act like we've already we're not going to set up the instruments right now, but just the contents of the sterile setup. So the next thing that's easiest to open up is your gloves. So what we're going to do is now as the doctor comes and assistant comes in, obviously the assistant will come in first after she's scrubbed in. She's already put on her bouffant cap as well as her mask. Okay? So once the bouffant cap and mask are placed, then the assistant will then go scrub in. Once the assistant has scrubbed in, they will then come and put the gown on, the very last thing you're going to need are the gloves. So let's go ahead and get the pair of gloves, please. Both of them. Again, opening up everything in a very sterile, sterile fashion where I can grab it and not come in contact with anything that's not sterile. That's what the non-sterile's main function is, to basically open up and facilitate everything in a very sterile fashion. So if we look at the order of everything we're going to need the gloves last. Now the worst thing we can do, by the way, is leave the gloves like this and put it like this, like that. So now imagine the doctor or assistant's already opened everything, or rather put the gown on. You're ready to put the gloves on and they're still closed up like that. So what we do is, to facilitate a seamless procedure, is open the gloves up in the way that you would use them, which is like this. Here, and you're opening up the pack like so. And again, we open up the top, bend it back, and we give it a little push, and now the gloves stay in place. Sorry, the package stays in place and the gloves stay exposed. So your gown goes next. And again, just to show the order of everything, because you will already have this on, there's your bouffant cap and your mask. So bouffant cap, mask, gown, and then gloves. This is the order of everything. And the other glove is, again, for the assistant as well as the doctor. Open one thing up at a time. You grab it, again, sterile fashion. And again, the worst thing you can do is keep this closed. Let's go ahead and move this to the side. Open this up. Again, only touching your sterile draping. And now I'm going to fold that seam there and fold that seam there. This packaging can touch the wall, it's not a problem. Then the gown, again, the bouffant cap, and the mask. So now this is very user-friendly for the doctor and assistant to both come walking in, put their gown on, don your gloves, now you're ready to go in the procedure itself. And we'll show that in just a little bit after we've separated everything else out. Now, let's look at things from a patient's perspective. The patient comes walking in and they see everything draped and they know they're getting ready for surgery, and they're going to be a little bit nervous, quite honestly. One of the things I like to do with your sterile towel, which is very, very user-friendly, by the way, the sterile towel, your instruments are right here in the middle, right behind the patient's head, relative to your counter space. So this is where typically the assistant and the doctor are working off of for their instruments. So your instrument setup, you can just imagine, is right in the middle. What I like to do is open up your sterile towel, like so, and simply drape your instruments from that perspective. That way, when the patient walks in, they're coming in, you're getting ready to seat the patient. They're not, obviously, immediately they're looking at the whole contents of the room. So you don't want to have them freak out and get nervous by not covering your surgical instruments. So make sure and cover those surgical instruments for efficacy aspect. These light handles have a very distinct and very user-friendly, as you can hear, adhesive to it. So this adhesive is really nice for you to be able to apply to the light handles, and it's very easily positioned because of the consistent area of the stickiness. Here we have an oral surgery operatory that my assistant is going to position in ideal position there, and then all I'm going to do is come around here and simply put the adhesive on like so. Now you're easily able to move this in a sterile fashion. This O-Pak has some very, very user-friendly drapings for the counter. In a sterile setup, your counter drapings are very, very, very important. Why? Because the assistant has the sterile side, the patient behind the head has the sterile side for your instruments, etc. And then we'll show you the other area in just a second that's going to be completely covered in sterile as well. So let me show you how to facilitate that. So the very first thing is just grab it by the corner. This is a sterile drape, and again, you don't want it to come in contact with anything non-sterile until you're ready. What that means is the adhesive, as you can clearly see here, we want to be able to stick it up onto the counter, but actually up on the wall just a little bit, because the adhesive will stick to the countertop. So let me demonstrate that. So we simply remove the adhesive like this, and again, drop it on the floor. We will clean up afterwards. You control your drape with the adhesives here, and then you simply put this up onto the countertop, up on the wall, and push it from the inside without touching the wall, because this is sterile, like that. Now, the assistant has a completely sterile area. There's one other great thing about the O-Pak, however, as my assistant will show you. She's going to do this in a she's touching a non-sterile bag, right? But now the bag has an adhesive on here that will now act as a trash bin. So we'll put it over here to the side, here, and then we're just going to attach it to the drape instead of the counter. So now, as the assistant is using your hazardous gauze, etc., your biohazards, you simply drop it into the sterile, non-sterile bag here, trash bin, let's call it, and proceed with the procedure. So that way everything is nice and clean and organized. We have the assistant's area draped. We have the doctor's area draped as far as behind the patient's head. Now we have what's called the Mayo stand. The Mayo stand is actually the stand that can be pulled over the patient chair and have a very, very user-friendly work area there. But again, everything has to be steriled, covered and sterilized. So again, grab this by the corner and let it fall, and it will open up into its full size. We then simply open this up, remove the adhesive, drop that on the floor. As we open this up here, we want to center the drape right on the middle of the Mayo stand, because that's where we'll be, and put that right towards the end of the Mayo stand cover. And that now covers your work area that will be slid over the patient itself, simply like this, for a very, very user-friendly work area. So there it is. Everything is, your 3 work areas are now completely sterilized and covered. We're almost done with the complete procedure. Now you can see I no longer have my gloves on, because now it's time for me to don my sterile gown, as well as now the next thing will be to drape the patient afterwards. So I have to do that in a very sterile fashion. So the very first thing I'm going to do is put my gown on and gloves. So what I like to do is I like to very succinctly grab the gown by the corner and then let it simply fall, as the gown will naturally open up by itself. Then we simply, from the inside out, we're going to put our hand through the back, and then the other hand through the back, and then roll up without bringing your hands out of the gown. So your hands stay underneath the sleeves and sterile. Now my assistant will then tie me up from the neck first. Now you see the front ties here, so you have to turn towards your assistant. That's one side. Then I'm going to turn the other way here and let her grab the other side. And again, remember, without your hands and so forth sticking through the gown. There's a reason for that. You'll see in just a second. All right. Now what we're going to do is actually don our gloves. So I'm going to move towards the front here. Now remember, as you open up your glove bag, your right is always on the right-hand side and your left is always on the left-hand side. And it clearly says R and L on there. So what I like to do is now stick your fingers through the opposite finger first, what glove you're going to put your hand on, and grab it again by the edge. Then stick your fingers through just a little bit. Thumb is always up. And then again, put your glove on like that. Now you see why we didn't put the fingers all the way through the gown, because now you can clearly see how the gown is now underneath the cuff of the glove. Repeat that procedure for the left-hand side, barely sticking through. You put this in here, and as your thumb comes up, your glove then encompasses the gown itself. The main thing is when you're putting your gloves on to be comfortable from there. So in the gown itself, you clearly see how you can now adjust the height of the gown to make sure that it's comfortable and not too bulky underneath there. So this area here needs to create a seal for you to be able to do that. And after you've donned your gloves, then you simply adjust from there to make sure everything is nice and comfortable. And then you remember, this is your neutral position right here. So when you're not doing anything, your hands are not doing anything, don't let them, as an example, hang to the floor. Simply put them right here in this work area from here to here. And this is the final and last part of the procedure, which is the donning of the sterile draping for the patient. Now, let's assume again, the patient is in the supine position. What I'd like to do is just show the patient for now in this position. As the very first thing we need to do is always start with the head covering or the bouffant cap for the patient. So what we want to do, especially if the patient's a female and you have a longer hair, you simply put the excess around here and then pull the bouffant cap forward, following the hairline, so that way you can come up like this, and this is not too much in the eyes and the patient doesn't get claustrophobic. Go ahead and lean back just a second. Now what I'm going to do is just move the patient back just a little bit. Get the patient comfortable. Now the patient is in a prone position, but at the same time what we need to do is sterilely cover the patient. So notice the draping here has again an adhesive here. So we'll open this up like a book, similar to this, and then we'll find the seam in the middle and let it drop down like this. Now the easy way to do it is find the adhesive and simply open it up and pull it down. So what we'll do is put it on top of the patient from this end here, hold it here, and then simply pull it down from there, covering the patient's legs, whole area, giving the doctor and the assistant a very nice sterile working area. You can also adjust with the adhesives here to be able to just put this around the head. It's not necessary. I like to just tuck it, move your shoulders forward just a little bit, tuck it underneath here and here. That way you're not dealing with any of the adhesives stuck to the chair itself. The final procedure, or rather the final step I would call it, is now utilizing your sterile towel as an absorbent area, but also for any instruments you may have, etc., that don't come sliding off. So now the patient is sterilely draped, bouffant cap, nice clean working area, and the surgery is ready to proceed.